Adjumani Hospital has successfully completed administering the first batch of malaria vaccine to children. The R2 Matrix M malaria vaccine is administered in 4 doses to children between 6, 7, 8 and 18 months below the age of 2. Lulu Mary Awira, the in charge of Young Child Clinic at Adjumani Hospital, revealed that 450 doses of the malaria vaccine were administered in the hospital since the exercise began on the 2nd of April 2025.
When you immunize the one for 5 years, definitely it will not finish the dose. Because this child is to finish her dose at the age of 1 year and 6 months. For those who begin exactly at 6 months. But the others, since it was brought late, the others will begin at 9 months, 7 months, 8 months, and up to 1 year. So 2 years we can also give. But for us here, we never vaccinated 5 years. Because honestly, when you immunize the 5 years, definitely we will not finish.
She also explained that no resistance from the community against the vaccine was registered during the exercise, despite several rumors and misconceptions about the drugs reported in some parts of the region.
Since we started with the malaria vaccine program, since we started the 2nd of April, it was okay. There was no resistance we got from here. We were given 450 doses of malaria vaccine, which was to be used. And since then, we started using it for children from 6 months up to 2 years. They are getting their first dose from this month. And since April is a Child Health Day, and even outreaches have been conducted whereby the vaccine, we have been using it also outside, but we never got any resistance from the community. They were appreciating, they come willingly. They were so good to have the malaria vaccine into existence.
The medical superintendent of Adjumani Hospital, Amber Michael, urged the community to embrace the vaccine in order to curb down malaria cases among children.
In the country, malaria is the leading cause of disease burden and also one of the leading cause of death, mostly among children, due to the various complications it brings. And the commonest ones is anemia related and many others. So the country, the Ministry of Health, thought it wise to introduce the vaccine against malaria, mostly targeting children. This vaccine were already used in other countries before Uganda could adapt. And it was launched early last month. But the main target is mainly children, starting at 6 months, then 7 months, 8 months, 9 months, and then 18 months. So its uptake, the experiment of last month was just to introduce the public that we have a new vaccine which has been introduced.
Mitirikwe Lydia, a mother who had visited the facility, encouraged fellow mothers to also have their children vaccinated to ensure they grow healthy and safe from malaria.
The reason why I got my child for vaccination or this service is I need a healthy child. Because when your child is healthy, you also feel good as your mother. So I feel by bringing this child here, my child will be a fruitful child for future. And the main reason for my coming here today is just to take the weight and more so the vaccine of malaria, because it's really affecting us so much. I always encourage my fellow women to always put vaccination as a priority, because when you vaccinate your child or you bring her for vaccination, it also gives you time to look for other things instead of every time coming for treatment or seeing your child being affected by what can be prevented.
In Uganda, cases of malaria contribute to 40% of outpatient visits, 25% of hospital admissions, and 14% of hospital deaths. Kashunrat Fancy Onzima Alan reporting for West Nile Television Nilecast.